We're living in an age of extraordinary scientific progress. Yet for people living in many low and middle income countries, essential medicines are often unavailable or unaffordable. This inequity is the greatest global health challenge of our time.
Where you live should never determine whether you live or die, just because you can't access the medicine you need. But today, for millions of people, this is their reality. If you live in a high-income country, you can usually access the medicines you need, whether it's for insulin for diabetes, treatment for cancer, or antibiotics for an infection. But in many low and middle-income countries, that same medicine may not be available or simply unaffordable. Access to medicine is not guaranteed. Around 2 billion people still lack access to essential medicines, and not because medicines do not exist. It's because access depends on choices and systemic decisions, like how medicines are developed, priced, and made available across countries. So who makes these decisions? A small number of pharmaceutical companies produce most of the world's critical medicines. Their decisions about which diseases to prioritize, which countries to serve, what price to set, influences who gets treatment and who goes without. At the Access to Medicine Foundation, we match our independent research to the real-world needs of patients and healthcare workers. We show companies how to turn decisions into access for the communities that need it the most. And because we don't take funds from these companies, our findings remain unbiased. And since investors use our findings, companies pay attention. Through our evidence-based research, convening power, and change-making tools, like the Access to Medicine Index, we bring clarity and accountability to a complex system. For the past 2 decades, we have proven that using research to influence change works and delivers measurable impact. Access is now embedded in the core business strategy at the world's leading pharmaceutical companies. Board-level accountability for access has grown in recent years. And behind that are real decisions. But is that enough? Progress is still uneven, and much more needs to be done to reach the scale of people waiting for access, especially women and children. This is where your support makes a difference. It will fuel the independent evidence-based research and will strengthen our ability to drive systemic change. But we cannot do this alone. By investing in our work, you help influence decisions that shape access to medicines worldwide. With your help, we have the potential to reach 4 billion people globally who still lack equitable access. And this includes more than 800 million women, more than 1 billion children, and more than 20 million babies. At the end of the day, a breakthrough medicine only matters if it is actually reaching the people who need it the most. Imagine a world where no one is left behind. Together, we can make that world a reality.